Meningococcal infection is caused by the bacterium Neisseria meningitidis, also known as the meningococcus. The bacterium was first identified by the Austrian physician Anton Weichselbaum in 1887. He discovered it while investigating an outbreak of epidemic meningitis in Switzerland. He named the bacterium Diplococcus intracellularis meningitidis, and later it was reclassified to the genus Neisseria in recognition of Albert Neisser, who first described the causative agent of gonorrhea, Neisseria gonorrhoeae. Meningococcal infection is caused by the bacterium Neisseria meningitidis. The primary routes of meningococcal transmission and infection are respiratory droplet transmission. The bacterium is primarily spread through respiratory and throat secretions, like saliva. Close or prolonged contact with a carrier or an infected person facilitates transmission. Examples of such contact include living in the same household, kissing, or sharing utensils or cups. Direct contact. Besides respiratory droplets, direct contact with an infected person's secretions can also lead to transmission. This is less common than droplet transmission but can occur, for example, when a person touches the secretions and then touches their own nose or mouth. Asymptomatic carriers. A significant proportion of the population can carry Neisseria meningitidis in their throat without showing symptoms of disease. These asymptomatic carriers can still transmit the bacterium to others, especially if there's close contact. Once the bacteria enter a person's body, they can travel through the bloodstream and cross the blood-brain barrier, leading to meningitis, which is an inflammation of the membranes surrounding the brain and spinal cord. Additionally, the bacteria can cause septicemia, which is a severe bloodstream infection. It's important to note that while the bacteria can spread between people, meningococcal disease is not as contagious as diseases like the common cold or the flu. Nevertheless, certain factors can increase the risk of disease, including age. Infants and young adults have higher risk, certain medical conditions, or living in crowded environments such as college dormitories. Meningococcal meningitis. Sudden onset of fever, headache, stiff neck, nausea or vomiting, increased sensitivity to light, photophobia, altered mental status or confusion, seizures, in some cases. In infants and young children. Irritability or poor feeding, inactivity or sluggishness, a bulging fontanelle, the soft spot on the top of a baby's head. Meningococcemia. Abrupt onset of fever and chills, fatigue, vomiting, cold or pale extremities, severe aches or pain in the muscles, joints, chest, or abdomen, rapid breathing, diarrhea, a dark purple rash which can start as a pinprick and turn into larger areas of bruising. Both forms of the disease can progress rapidly. The rash associated with meningococcemia is a particularly concerning sign and indicates a need for urgent medical attention. It reflects the bacteria's presence in the bloodstream and their effects on blood vessels. It's essential to seek medical attention immediately if someone is suspected of having meningococcal disease. Early diagnosis and treatment can significantly improve the outcome. Meningococcal disease, caused by the bacterium Neisseria meningitidis, is a serious and potentially life-threatening condition. Immediate medical attention is essential. Treatment for meningococcal disease typically includes antibiotics, primary treatment, administered as soon as possible even before diagnosis confirmation. Common choices are ceftriaxone, cefotaxime, penicillin G for certain strains. Supportive care, which may require hospitalization and includes intravenous, IV, fluids to treat dehydration and maintain blood pressure, oxygen therapy if necessary, medications to reduce fever and pain, medications to control seizures if they occur. Close monitoring. Especially important for patients with meningococcemia, focusing on vital signs, organ function, and blood tests. Treatment of complications, addressing issues like shock, respiratory failure, or disseminated intravascular coagulation, DIC. Prophylaxis for close contacts, giving prophylactic antibiotics such as rifampin, ciprofloxacin, or ceftriaxone to those in close contact with an infected person to prevent secondary cases. Vaccination. A preventive measure against certain serogroups of Neisseria meningitidis, especially useful during outbreaks. Early detection and treatment are vital. and anyone suspected of having meningococcal meningitis or meningococcemia should seek medical attention immediately, not waiting for confirmatory tests before starting treatment.